This week on Africa Health Check.
I think there's so many things that our people don't know, our health workers don't know, I can say that. Like, we still have a long way to go.
The big deal is when you mention COVID around them. Even when you have such diseases, people will not respond so much.
We highlight the importance of effective health communication.
Therefore, partners also towards the grassroots level, such as community-based communication together with development communication, is also crucial. So when you go
and look into ways the African continent can improve its health communication tools. Good day. Welcome to Africa Health Check, where we reflect on the health status of Africa. I am your host, Hohontlejang Paladi. On this episode, we will be discussing the importance of communication in public health. And to help me unpack this, our special guest for this episode is Lebohile Diswai, who is a communications, coordination, and advocacy expert. We also have our usual commentators, Dr. Marianne Mureithi, who's the current chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. But before we hear from these experts, let us have a look at this episode's feature.
My name is Atwabas. I'm a communications professional with about 9 to 10 years working in Africa and also in the Middle East. My expertise comes with making sure that communication becomes the solution to many of the world's problems and challenges that we have faced. Also, I'm a psychologist by training, and that puts me in a category where sometimes in health communication, I find myself in that place. Well, effective communication as a training or a tool for health professionals is key, because looking at our terrain here in Ghana and most parts of Africa, we are looking at the situations of stigma, which becomes an end result sometimes when certain issues of health are communicated. However, the eclectic approach has to make sure that it's simple enough for persons to understand what health professionals are communicating, and in most cases, putting away a lot of jargons and putting it or simplifying the conversation so that people would understand. Today, health education is done combining all ways by which contact can be made. Face-to-face is a very crucial one, which in turn assures the person looking you in the face and getting trained to know that they can actually go out there and do the work. But after that, simulating circumstances and bringing up scenarios for health professionals to consider is also another of such that can be done. During our period in COVID-19 in this country, in Ghana, I'm happy to have been one of the communication persons on some of the Ministry of Information concepts for development. And one of the things that we did was to create as many scenarios as possible that puts healthcare professionals, who are especially frontline professionals, to be out there to share their experiences with persons and to have certain conversations with them. Proper education of healthcare professionals on how to communicate is important, especially during the mass media publications that we've had, of which many could fall under false news, explaining how COVID-19 was spread and how many people had been infected and how people were dying through the process, whether it was a case of underlying health problems or directly dying from COVID-19, for example. These were a few of many examples that we've had here in Ghana. And moving forward, in the case of inadequate training for healthcare professionals when it comes to communication, then we can understand that we are at a loss completely. If the healthcare professionals cannot communicate effectively one-on-one and cannot also communicate effectively to the media, then we are all misinformed or we are lost. I believe that all rallying partners and collaborators will come together strongly and effectively to make sure that communication on the continent when it comes to health communication is effective and truly instrumental in dealing with diseases and the control of diseases.
Thank you so much for joining us on the show, and I'll just take this moment to just welcome you to Africa Health Check.
Thank you very much, Gigi, and thank you very much for having me on this show. I look very much forward to having this very important conversation.
Thank you so much for making time to join us. At Africa Health Check, we like to just start off by asking our panelists to introduce themselves, give us a little background about who you are, where you're from, where you're based, and how you got into your line of work.
Well, Gigi, as we said, my name is Yolebogile. I am from Botswana. I am a communications and advocacy expert, and I've really committed the bulk of my work in working with the UN Common System, where I have done emergency and humanitarian communication response in South Sudan. I'm currently based in Syria, and I've worked with UNFPA. I'm currently working with UNICEF. I've done a lot of volunteer work and also a lot of strategy work in Africa as a whole.
Really, really impressive. How did you get into communications and particularly emergency response?
So I got into communication because this is something that I've been very, very passionate about. Initially, I thought I would go into broadcasting. I did a little stint in broadcasting after I finished my degree. But then as time went on, I actually realized that I have a lot more passion in development work. And I figured out that, okay, I can actually merge the two, development work and also communication, into one thing. And I've been fortunate enough to actually now be able to grow my career into humanitarian work and emergency response. And that's really now where my focus area is and where I'm building my expertise. So yeah, that's been my journey so far.
Yeah, absolutely. So today we are discussing the importance of communication in public health. And in the context of public health, where would you place the important role that communication plays in public health holistically?
It's very interesting because oftentimes we see the communication being placed at the very end of response, but it's very important for communication to be placed at the very beginning when you're developing the programming and when you're developing how you're going to respond to a particular issue. So it's very central. It's very key in emergency response or health response. We usually actually have to integrate it even into our health policies. How are we going to actually communicate? How are we going to roll out? Should a pandemic come up? Should a crisis come up? We should have a central or rather an already developed template at the very least of how you're going to roll out that, because that actually informs how successful a program or a response is going to be. Otherwise, people don't know what to do. People don't know where to start. So it's actually very integral in our response in any kind of health situation.
And what we're looking at COVID-19, because that's really what has captured the entire world for the last 2 years. We've been at the mercy of the pandemic. What would you say are some of the things that worked and some of the things that did not work in terms of how communication and campaigns that came as a response to COVID-19 have been running from the beginning, in the middle of the pandemic, and where we are now?
When I think about the COVID-19 pandemic, one of the key things that I noticed were really needed more improvement was there was a big data deficiency, if I could say that, and I think it's also because of the nature of the pandemic. Nobody had seen this before. So of course, there'll be a little bit of data deficiency. However, in the same token, in an instance where we find ourselves where we don't have enough data, there was also a lack of transparency. We cannot build trust in communities and individuals where there's no transparency. We have to communicate, okay, there is a data deficiency in this area, but this is why there is a data deficiency in this area. And moving forward, this is how we're going to build the gap, fill the gap on this instance. So there was a lot of secrecy or shrouded with mystery. And I didn't think, like, in my opinion, I don't think we needed that much mystery, because that only aggravated anxiety, that only aggravated uncertainty in communities and individuals. People were not sure what to do, how to respond. And also there was a lot of misinformation because of that. I remember, we also needed to do massive drives of trying to get people not to spread misinformation. But the root cause of that was the initial non-transparency in the whole process. So I think that's an aspect in health communication that we really need to do better in.
Absolutely agree with you on that, Gulabkhile. I'm going to move to Reverend Achampo. Maybe you could share from your experience as a community leader, but also the Ghana experience. What worked, what didn't work regarding communication in response to the COVID-19 pandemic?
Yes, I do believe that relative to the subject of discussion, communication, health communication, I would say is the strength and the live wire of healthcare delivery. What Ghana experienced at the start of the COVID pandemic was a lot of misinformation. And even those information that tended to be somewhat credible, they still lacked depth and they lacked precision until doctors and various health institutions and people came with accurate information about what was actually going on. And I will say that up till now, people are still in doubt as to whether the COVID is real, apart from all the medical research, all the what science has put out. People are still believing that it is a 5G thing. It is a spiritual thing. So the subject we are discussing today is very, very important, because without proper health communication, information, what we seek to achieve, that is take hold of the pandemic and bring it to control, and all this will be defeated.
Thank you so much for sharing that. Totally in agreement, Reverend. And I'm going to move now to Dr. Mary. And I know that issues of communication, and particularly issues concerning misinformation regarding COVID-19 are ones that closely resonate with you. So I want you to share with us, what do you think worked, what did not work absolutely when it comes to communication regarding the COVID-19 response?
But at the beginning of the pandemic, as a case all over the world, we saw that there was a lot of misinformation. I think even to add to Reverend's point, there was this notion that something to do with Bill Gates and trying to control the population of the people. But what really worked was constant and approach in communication, having the scientists, having government, policymakers, and healthcare providers who are chosen to speak to the media, speak clearly, educating what the virus is, how it's prevented, and how to prevent it even at a community level. Simple actions as washing hands. I remember even appearing on a TV screen teaching the population how to correctly wash hands. So that was a very interesting approach. But end of the day, with the constant messaging, using all the tools available, that is SMS, because everyone in Kenya seemed to have a mobile network, mobile machine, so they could receive these messages. Radio, where most homes have radios, having posters, having engaging the youth as well, making diagrams, fantastic artwork in the streets. We saw that all over Africa. That type of communication really resonated with the population. And by now, 2 years, 3 years later, post the pandemic, we have people now understanding how not just to prevent COVID, but other respiratory tract viruses very well. And again, we just continue to educate people, communicate the importance of vaccines, not just COVID-19 vaccines, but others that are still available, not just for children, but for adults. We have influenza, we have the flu vaccine, we have the pneumococcal vaccine, which is crucial also for people over 65. And there's now education materials and communication materials and tools to educate why that is important. Remember, we've been talking about also emerging and re-emerging infection. So we still need to continue to educate people on infections, how they're prevented, and how to interact better with our environment, with each other, and also on how to treat other infections when they come up so that we can prevent future pandemics. And the only way to do that, apart from vaccines and other measures, is to effectively communicate.
Thank you so much for that, Dr. Mary. And remember, today we are talking about the importance of effective communication in public health. And just before the break, you told us about the importance of ensuring that at policy, at programming level, communication is prioritized in public health and not just sort of the technical side in the response. And I want you to sort of just expand on that and maybe talk about what are the characteristics of an effective communication strategy or plan when it comes to public health.
Thank you so much, Gigi. So the initial stage of a public health sort of campaign, at the very core of it, we always have to apply the do no harm principle. So our communication should not do more harm to communities, to individuals. And the second thing is also, you should also definitely do target audience mapping. Who is being affected? Who are the affected populations? And how is the situation actually affecting them? And what can they do? Because we also have to ensure that we empower people to make the best decisions or social behavioral change for themselves. And that starts with empowerment. Secondly, the information needs to be accessible. Information can be accessible, but it also has to be linked with accessible services. There is no point in us communicating XYZ when the services themselves are not accessible to the general public. It needs to be believable. It also needs to be simple, simplified to the relevant population. I find that a lot of times health practitioners or health communication is very technical, but it's technical for the person who is developing the strategy. But what you're supposed to be doing is developing the strategy for the person at home. They should understand it. It should also be trustworthy. The messages should feel like, okay, this is a source I can trust. So we use the sources or the tools that are believable and trustworthy to the people who are receiving them. So it should also be credible or viewed or perceived as credible. It should also be measurable, because a lot of times we don't invest enough in measuring the outcomes or the impact of our communication. And that also, it hampers even the next phases of the response, or it hampers other future different types of responses. Because when you build on that, on data, you're actually able to, even for the future, create a better response for people. So those are some of the important aspects when we talk about communication in health crisis or in public health.
Thank you so much for that, Lebo. And I know that there are experts like yourself that can be brought on to sort of provide guidance and leadership in terms of implementing the communication side of a public health response campaign. But I wanted to ask you, do you think that it's also important to frequently organize capacity building sessions for frontline workers who actually deal with these issues firsthand and on a daily basis?
Oh, definitely. Let me just give you an example of the COVID-19 pandemic. We did not see a lot of people as frontliners. However, for example, teachers were frontliners. They have to deal with children on that frontline basis, on an everyday basis. However, they were put at the very back of the response. It's very important to educate frontliners. It's also very important to do media training, because they're also responders. What I have actually seen is that sometimes media is integral in communication. However, they're not capacitated enough. So you'll find that sometimes it's actually possible for media to do more harm than good, simply because there is not enough training, there is not enough health communication capacity building. So let me just give an example. In the instance of gender-based violence, sometimes I see headlines and I'm like, oh my goodness, what is this? Because this headline is creating more harm. And media houses would invest more in, let's say, an entertainment anchor or a sports anchor, but who is actually taking into consideration having anchors who are actually educated in communication, in health communication or development communication. So yeah, absolutely, definitely. We have to definitely put more, invest more in that area.
Thank you so much for that, Gyolebogile. And moving to Reverend Achampong, just briefly, what would you say are your key recommendations for implementing some key strategies or mechanism to ensure that we incorporate communication as part or as an important component of public health response?
Gigi, the subject of health communication in Africa runs into a very strong headwinds. By headwinds, I'm referring to, number one, that you have communities and cultures that are embedded in superstition. Because for some people, how diseases come about, how they are diagnosed, and how they are treated, all assume spiritual dimensions, spiritual proportions. And so any idea or any policy that is formulated concerning health education must take into consideration this huge dimension. Another thing that we must be taken into consideration for a proper policy on health education is to understand or believe that there are a lot of people that are geographically inaccessible. Where they live, no lights, no proper amenities. So if our traditional means of communicating, disseminating health information is through TV, is through internet websites, is through social media, they are all cut off. And then how about uneducated people, the illiterate, who cannot read the pamphlets, they cannot even interpret the doctors, whatever they say. They must also be taken care of. And then the channels of communication, as I alluded to. If we're going to help health communication in this discussion, let our policymakers, let our public and private sector partners all cash in and support this worthy cause, because everybody has a right to health. It's a human right for everybody to receive proper health information for their own life and betterment.
Thank you for that, as powerful as always, Reverend. I'm going to go to Dr. Mary Ann. What would you say are some of the key strategies that we can employ to ensure that we incorporate communication as a quintessential component of our public health?
So again, the beauty of coming last in this discussion is that the speakers ahead have already really spoken of the main key points, involving communities, considering the illiterate who cannot read or understand some media platforms, how are you getting down to reach to them? And in our scenario here, we work quite a lot with what we call community peer leaders. So people within a community setting that you trust, that come in together. Sometimes we call meetings here in the health facility, in our research institutions, and then educate them on the relevant health matter of the day. So that is matters of protect them against sexually transmitted infections or even COVID-19. So we start with the community leaders, the peer leaders, who then go down to the community level and then explain to the people in the languages they understand, maybe through even animation where they have a little play, and in that play they can relate to the health matter of the day. And also sometimes we do organize like community matches, if not having a walk around within the communities, holding banners. And recently we did that for World HIV Vaccine Day. We were increasing awareness that the world still needs a HIV vaccine, and we carried banners around the streets, and we were able to interact with the members out there, just drumming up support for them to participate in a much stronger way in research, in HIV research in this particular manner. And also we saw in COVID-19, we had all media outlets, be it print, be it radio, be it television, having even small diagrams to be able to break down even to young children. I do also agree we did not involve teachers, and I participated in a program late last year where they again using, there was a MasterCard Foundation, African CDC, they involved schools, they involved teachers, and then these teachers were used to educate other teachers on preventative strategies against COVID-19, and vaccines being one of them. So again, I always say the future is bright, that we have so many innovations coming up, and communication will be one of the key tools to be able to get ahead.
Thank you very much for that, Dr. Mary. And I know that you're extremely passionate about this particular side of public health. I'm going to go to Kyolebogile just to give us a parting shot regarding the importance of effective communication campaigns as part of our public health response mechanisms.
I mean, it's very important to centralize communication in our responses, and it needs to be plain and simple and honest and transparent, and also culturally relevant. In the context of Africa, there's so many diverse cultures, there's so many diverse demographics, and each message should be really tailored to those specific affected populations. So I really hope that more investment can be made in that. I also hope more investment can be made in research, because everything that we communicate should be research-based and evidence-based. So that is a big gap currently in Africa, definitely. And it's not that we don't have the expertise, it's that we don't have enough funding, we don't have enough resources. So in the future, definitely, I hope that we can actually invest more in development or rather health communication.
Thank you so much, Kyolebogile. Thank you, Reverend, as usual, as well as Dr. Mary Ann, for your really thought-provoking and insightful conversation. I think one of the things that is really strongly coming out of this conversation is the need for honest and transparent communication, which is something that I think a lot of our stakeholders take for granted. But what breeds anxiety, hysteria, and reckless behavior is lack of knowledge, is when you feel like your leaders are hiding something from you. So let us do things differently. I know right now there's a bit of hysteria developing around monkeypox, and again, it's because of lack of honesty and transparency by our stakeholders. So let us do better to ensure that communication is not an afterthought. It's actually the cornerstone of every public health response campaign or programming that we are doing. This is Africa Health Check. Do connect with us on our social media platforms. We'll be happy to hear from you. Until we meet again, same time, same place, same day. Remember, the future is Africa. The future is today.